So a big part of what I want this channel to be about is to make things easier for the newly diagnosed people with Ehlers-Danlos syndrome or hypermobility spectrum disorder, or even if you're still waiting for a diagnosis. So this obviously then would involve me discussing issues that if you've had EDS for years, you probably know well about. So if you know about upright MRIs, you can skip this video. I'm going to go through the basics of what it is because I know if you're newly diagnosed and you're in online groups, you're probably reading a lot about them. And you're probably wondering, well, what's the difference between having an upright MRI and just the normal MRIs that people have all the time? And so I suppose firstly I should say that there's no upright MRI machine in Ireland. So you probably have noticed that many people travel to London or further for their upright MRI. And really, so if you're going to travel for this upright MRI, you need to make sure that you actually need one. So how should you know if you need one? What is it used to diagnose? And I'll go through all of that today. And if there's any other questions about upright MRIs that I don't cover, please leave a comment and I'll try and get back to you. So basically, someone with EDS or other conditions might require an upright MRI if normal MRIs come back saying that they have no obvious issues going on, but your consultant or some form of specialist might think that your symptoms are a sign that maybe there's either spinal instability somewhere, probably cervical instability possibly, so that would be here in your neck, or that you might have Chiari malformation. Now, Chiari malformation and instability are two big topics that I should probably do different videos on to cover the basics. So try and ignore those names for now if you're not sure what they are, and don't get bogged down with that right at this minute. But basically, you might have the MRI and you might meet with a consultant who says, you still have the symptoms that I think you might have A, B, and C. So the only way to see this sometimes is on an upright MRI. So for instance, in my own case, I had a lot of neurological symptoms. I had numbness down the left side. And I had particular episodes that were getting worse and worse with time. I'd ended up in the hospital here in Dublin, up the road, and I was there for about a week. And at this stage, I had already decided through my consultant in London, who agreed with me that I should get the upright MRI. Unfortunately, because we have no upright MRI machine here, there was very little they could do for me in the Dublin hospital. I was under a good neurologist while in the hospital who had an interest in EDS at least, and was very fascinated by the whole process of the upright MRI, and was very apologetic that we don't have one here to see what the issues are going on. And she also agreed that I should definitely go ahead and get this upright MRI. Now, I'd be hesitant in getting one obviously because they're expensive, like everything else is in London. So I'd already seen my consultant in London, went through my symptoms, and he believed that I should go for the upright MRI. So he was able to refer me on then in London for that. So a few months later then I ended up having it. Now I said price-wise, mine was roughly €1,200, I believe it was. That's not cheap. And that was I only had the upright MRI done on my cervical spine. Because, for a lot of people with EDS, you might have, as I said, you might have heard the term cervical instability, and then a lot of people also have Chiari malformation. So they're kind of the two issues that if you're going for an upright C-spine MRI, that's what they might look at for. So that's what I had done, and because of various symptoms that I had, including vertigo, which is completely different to the dizziness that I would feel in my low blood pressure, numbness down my arm, and just very, very strange head and neck pains that I'd been suffering with that were increasing. So I went to London, as I said, had the very expensive MRI, and when I got the results, it said that I had Chiari malformation and luckily only minor instability. So for me, it was good to have a further diagnosis. Both of them can be quite common with EDS patients, but luckily I don't need surgery. I try to manage the symptoms with medication and a bit of physio when possible to the neck area, and I also get pain injections, both nerve blocker and trigger point injections. So that kind of helps with my symptoms in that regard quite a bit. And even without the diagnosis from the MRI, I might have be getting that treatment anyway, because really surgery, if you have EDS, you might have heard that surgery can be complicated for EDS patients, especially here in Ireland when we don't have a proper consultant, and surgeons here wouldn't be very qualified when it comes to making the decisions that surgeons can, even in the UK. So usually there's different ways of performing surgeries when you have EDS to a patient that doesn't have EDS. So surgical options are quite severe, for Kerri malformation or for cervical instability. And for someone with EDS, if you're looking to get surgery for instability, you're generally looking at going to Barcelona or the US, which is very expensive, and it should be only done when you've talked to several surgeons. So you need that opinion of several surgeons. And in Kerri malformation, again, it's still a complex surgery. It's basically brain surgery, and with EDS there comes all those complications. So for my case, my consultant suggested just sticking with medication, physio, and trying to combat the symptoms that way. But I'm still very happy that I went for the upright MRI and that they found these conditions, because it's good to keep an eye on these things. I want to know for future reference, if there's ever a situation where even in a car accident, things happen in life, and it's good to have these diagnoses. I think sometimes if you have EDS or another condition, certain consultants can be like, well, what's the point of adding to your diagnosis? And I think it's good to know mentally what's going on. I'm not going crazy. These are why you have these symptoms. This is what's going on. So, is what's going on. So that's why people often go for the upright MRI, even though it's very expensive, to find out if they need surgery, first of all, and then secondly, to manage symptoms better over a long time and to just keep an eye on things. I had normal MRIs, and I'm sure you know what just a normal MRI is, where you're lying down into the machine. I had several of them over the last few years, and even before I was diagnosed with EDS, I had consultants convinced I had MS because of my spasms and things like that. So I had so many MRIs, and never have they picked up my Kerri malformation, which is 10 millimeters, or any form of instability at all. So for my case, I really needed the upright MRI, because that's only when my issues show up. And when you're in the upright MRI, you're basically sitting upright, so that they can see, your brain and spine and everything under pressure, under its normal pressure. Whereas if you're lying down, like the normal MRI machines we have here in Ireland, you sometimes can't pick up on those kind of things. So that's really the difference. It seems absolutely ridiculous that we don't have one here in Ireland, and that we have to pay so much to go to the UK. So I would then suggest, if you think you have Kerri malformation or instability issues, and I'll try and do more videos on them in the future to discuss, then you probably will need to go see a consultant in London to talk about, should I spend this money on an upright MRI? They might turn around and say, no, we don't think you should. Also, a physio can talk you through, particularly in London, in the hypermobility unit, they can talk with you about what they think the issues are going on. I'd actually saw the physio after I had the upright MRI, and she said a lot of my C-spine issues are actually being caused by my T-spine. So it's the middle part of the body here, where my spine is actually locking, and it's making more work for my C-spine. So it's all very interesting and intricate, but only really a consultant can tell you if you need one. So if you're going to see a consultant in London, make sure to write down all your symptoms, and it will be some things that they ask, that they will be looking for to see if they'll have to, suggest to you that you need the upright MRI. And as I said, you can have years of the normal MRIs coming back completely clear and completely fine, and still have major issues going on. So it is important to listen to a consultant if you do go to see one in London, and what their recommendations are. I think that's it really. I suppose, it's worth you mentioning that, like, a lot of these services we don't have in Ireland. We don't have a consultant, and we don't have an MRI machine. And I think, even if you mention to doctors here sometimes about the upright MRI machine in the UK, some doctors know kind of about them, others don't, and it's kind of ridiculous. They really should at least know that they exist and that they're out there in other countries. And some doctors don't know about them, but they're fascinated at least. So at least there's an interest there. I know my own GP, she hadn't really heard of them, but she said that's actually a really good idea, because you'll notice sometimes with people, if they have arthritis or certain conditions in their knee, that they might be sent for x-rays where their body is in the normal movement like that. So it works in the same way, rather than you lying down relaxing and having an x-ray or an MRI that way, and your body not being put under the normal pressures that it is. So it really makes sense, the whole upright MRI thing, and it's just so unfortunate we don't have anything here in Ireland. If there's any other questions, as I said, leave me a comment in the bottom.